The burden of disease for healthcare-associated infections is absolutely huge. Think about it. We are talking about 16 million deaths worldwide just because of healthcare-associated infections. So this is effectively a very, very large burden of disease, and it's very clear that it has to be prevented. The financial impact of healthcare-associated infection is massive. We are talking for a country like Switzerland, small country, probably the equivalent of creating every year a new hospital, for example. We are talking of billions of dollars every year spent just because of healthcare-associated infections. But that's not the most important. Of course, money is very important, but what is even more important is to think about the number of lives that are lost because of infections, the number of morbidities that are acquired by families, the number of people not going to work because of healthcare-associated infection, number of handicaps that we are discovering because of the complications of healthcare-associated infections. So the burden of disease is absolutely gigantic. Well, I would say, of course, when you realize that, as we did, you could really change the behavior of healthcare workers by introducing a system change and by introducing a multimodal strategy that will help change behavior, you are very happy, right? Then, when you start to realize how much it is complicated to change behavior, then of course you go to many steps of frustration. Changing human behavior is difficult for anyone, and it's not your own responsibility. You have to rely on many aspects of a system or on many aspects of human behavior. So frustration comes very quickly then, because once you have the system in place, you know that a change, a minor change, can have major effects. And you see that people don't want to listen, or that people are against the system change you want to introduce, then of course it can be very disappointing. I remember here in Geneva in 1995, when we had started the campaign and we used some very simple things to hold the alcohol-based hand rub bottles like we recommended to use. We hold it like that. The day I came back to my own emergency room, and the system we had to hold those bottles on the bedside were actually all hanged on the ceiling. So the message was, Pittet, we don't agree with what you want to do. And the system change was actually a system failure. If you go to different places in the hospital, you have different risks. In the operating theater, in the operating room, in the post-anesthesia care unit, this is the place where anesthesiologists are at very high risk of making mistakes, right? It's a very technical work. They have to be very prudent. There are many, many things that they need to do quickly, in sequence, with the right order of doing things, and they need to be extremely competent in infection prevention and control. Whether this is hand hygiene, whether it is related to anything that you do around your patient care so that you don't harm your patient. Well, from the institution point of view, many things can be done. When you visit an OR, you realize that, things are not ergonomically well organized, and the institution is responsible for that. To find your alcohol-based hand rub right at the point of care without moving or standing or turning would be just an example I would give. To get your material to make an incision, to make an insertion of a catheter, to get your people to help you. So all of these can be improved. Teamwork is so important in these settings that everything should be thought more ergonomically according to this IPC concept of always do best performance by acting nearby the patient bedside. The vision for the future is really to make sure that we all work together in a multidisciplinary team, investing the top of the hospital to everyone in the hospital to improve patient safety and save lives. We know that improving hand hygiene can save between 5 and 8 million lives a year in the world. Preventing antimicrobial resistance will further help to reduce mortality by improving IPC all over the world, in every ward, in every hospital.